My name is Wendy Barnett and I'm Head of Professional and Clinical Services for Pet Blood Bank. I founded Pet Blood Bank in 2007. Before 2007 in the UK you were not actually allowed to store pet blood. So before that patients were dying purely because blood was not available. And it's very hard. Most emergencies happen late at night or at the weekend, and it's very difficult then to ask other owners of dogs that may be able to be donors to come in and donate at 2 or 3 o'clock in the morning. Now in 2005 the law changed to allow vets to collect blood, process it like we do at Pet Blood Bank, and provide it to their patients as and when they required it. Being able to access blood that is able to be stored in their fridge or the plasma that's able to be stored in their freezer makes life so much easier and reduces the threat of life really to their patients, and definitely helps increase how they can care for their patients. We decided that we would operate Pet Blood Bank as a charity, a not-for-profit organisation, and ask the general public to bring their dogs along to blood collection sessions and donate a unit of blood, which is about 450 ml, about 3/4 of a pint. They lie on a table, and in return for a tummy tickle and lots of stroking and fussing, and afterwards they will receive treats and toys and thank yous for coming and spending about half an hour with us. And that unit of blood is then brought back to our processing laboratory, where it is then centrifuged, and 1 unit of blood can help save the lives of up to 4 dogs. So it's a very valuable gift if your dog is able to donate. In 2010 we had over 2,500 doggy donors come to our venues. We have about 48 venues around the country at the moment, and our collection team in general are out at those venues about 3 times a week. The whole blood is collected, 450 ml, and that is divided at least into 2. So we centrifuge it down, the red cells move to the bottom of the bag and the plasma remains at the top of the bag. Within that closed collection system we're then able to remove the plasma into a whole unit to help 1 dog, or into 2 half units to help 2 small dogs. The red cells then have a red cell nutrient added, and that unit is then stored as a whole unit, or once again it can be divided into 2 to help 2 small dogs. Red cells are stored in the refrigerator. They last up to 6 weeks, so relatively short period of time, but it's in great demand. No sooner have we got it in the fridge at the blood bank, it's then being requested by vets around the country and is going off to help a patient of theirs. The plasma products last a lot longer, actually up to 5 years in the freezer, and we urge all vets to keep a unit of plasma in their freezer so that they've got easy access to it. Red cell products are basically red cells, and therefore any patient that is losing red cells or destroying its red cells can be given this product. So that would be anemic patients, dogs with autoimmune problems where they are actually destroying their own red cells, any dog that has received an injury or trauma and it's losing red cells and needs those replacing. The plasma products contain coagulation factors, and I think everyone will relate to haemophilia within people, and certainly there are haemophilia dogs as well. So plasma can help these patients if they are going through an episode where they are bleeding and they need assistance with to be able to stop that bleeding. Dogs do have different blood types. There have been 8 or more described. The most important as regards to transfusion reactions is DEA, dog erythrocyte antigen 1.1, and dogs in the UK are blood type for this antigen, and your dog will either be 1.1 positive or 1.1 negative. Negative blood can be given to both negative and positive patients, but positive dogs should only be giving their blood to another positive dog. Now that we have over 3,500 donors that have been blood typed at Pet Blood Bank, we are finding that certain breeds are predominantly one blood type or another. So our greyhounds, for example, about 75% of them are negative, and alongside those we have German Shepherds and Boxers, Mastiff breeds, English Bull Terriers, all tend to be 1.1 negative. And that's the blood that we are asked for the most by the veterinary practices. And I would ask any dog owner with that breed to come forward to register their dog at Pet Blood Bank and see if they could be enrolled in the programme to help other dogs. Pet Blood Bank is doing some research into coagulation factors to see how long they actually last within our plasma products. This is something that's very important for us. We've been quite restricted to travelling within 2 or 3 hours of our processing laboratory because it's been thought that coagulation factors only last about 8 hours before needing to be frozen and saved. Recent studies by us have shown that these are a little bit more robust and can actually be processed up to 24 hours and still maintain their coagulation factors, and this is allowing Pet Blood Bank now to travel further afield to collect blood. The future for Pet Blood Bank is to encourage lots more dogs to join Pet Blood Bank to continue to help the lives of thousands of dogs within the UK.